Now, tonight the world is screeching to a complete lockdown. The global economy is at an all-time low and the markets near collapsed. Yet this is just the beginning, as we are told. It could get worse even as China gets better. There are places that are hardest hit and those that are yet to report any case. But we are hopeful. The world is upbeat that it shall be vanquished and Kenya is in the right direction. Or is it? Tonight, the do's and the don'ts, the facts from the fiction, and also some positive news for you. Later, my guests will reflect on the cartoon of the week, Who Said What, right before Time Bar. But first, it's my take tonight. And this is very personal. My mama has been visiting the city for a while now, and as she makes her way back to the village, I've had to speak to her about why she should not continue shaking hands in the village when she goes up, why it is important to keep distance, and how to ensure she's safe in her home and even the surroundings. The challenge with the people like our parents is that they uphold very high socio-cultural practices, especially in a community setting. Now, she's an elder in church and a retired teacher. I don't see how she will not welcome the congregants with open arms in church. How she will turn down the man or the woman who stretches their hand for a handshake. How that random visitor who knocks at her gate will take it when she refuses to extend her hand or to shake the visitor's hand. But she has to. They have to learn that these are extraordinary times that call for extraordinary measures. It's not about feelings anymore, ma'am. These are the social behaviors that have to change, and it's overnight. That's if you haven't started. Now, this was President Kenyatta at Harambee House on Sunday. It felt well rehearsed, but the message at the end of the day was home. And this was also a picture that was taken during his press conference later on. The picture is coming up on your screen. Yes, that's the picture. It can no longer be business as usual. Stop shaking hands. Stop the close body contact. Sanitize your hands every few minutes. Wash with soap and water. And these are the basics, the bare minimums. Drastic measures have been taken across the world, and Kenya is no exception. I have seen some of us walking around with face masks. First, you don't need a mask to protect you from the coronavirus. Now, the virus is not airborne. It's more likely to be in your hands than in the air. This is why emphasis is on proper sanitation. The masks are actually meant to protect those around you, especially if they are sick already. But even as we, the citizens, do our part, the government has to do its part too. We have heard of cases where calls have been made asking for assistance in suspect cases. The response has been slow, we are told. Now, this needs to change. The more the information out there, the better for everyone. Damage control through scarce information and being cagey will not help the situation. Most nations that have succeeded in controlling the spread of the virus have demonstrated the power of information. It's also a timely call to our government to rethink the health strategy once again. And ultimately, this is one of those cases where we say, God for us all and everyone for himself. Do your part and everyone will be fine. Science has proven that it is possible to contain the virus. The numbers too show that we have nothing to worry about, as we'll find out tonight. And so tonight, we borrow our quote from Hippocrates, if I'm not wrong, that's the pronunciation. He's considered one of the greatest physicians from Greece. He says, healing is a matter of time, but it is sometimes also a matter of opportunity. My guest tonight, Dr. Oma Oluga, Dr. Paul Otuoma, and Dr. Mercy Mwangangi. We all have doctors in the house. My name is Ken Mijungu on Twitter, Instagram, and Facebook. Join our program tonight, and the conversation, as always, the hashtag is Sidebar. Sidebar begins right now.
The Ministry of Health has confirmed the first coronavirus case in Kenya.
The government is suspending travel. Only Kenyan citizens and foreigners with valid residence permits will be allowed to come in.
It's going to affect us. Luckily, we are entering into a low season.
We have suspended learning
If you're told to wash your hands with a soap.
I've not really come across any vehicle that uses a sanitizer.
China kumbuke ni nchi ambayo imeendelea. Je, ikisema Afrika hapa feri, mikakati bado haijawekwa.
Serikali ni lazima iwe macho.
This is where the real conversation happens.
All right, let's take a look at top trending before we embark on our conversation tonight. And this is what's on Twitter. Let's take a look at that. The COVID-19 KE trending right at the top. Stay home challenge, the other one, trending, obviously for the obvious reason. Chinese virus, trending also for all the right and wrong reasons. And coronavirus outbreak, those are the top trending topics for tonight. Let's take a look at this when we finish the show tonight. And ladies and gentlemen, welcome to our show tonight. And before we begin, because you have just touched my table, I'll just pass this around. You just need to do that because you have just come here. I don't know what you carry, and you're touching our table and glasses. And obviously, let's begin the discussion with the announcement tonight from the Cabinet Secretary in charge of Health. This is Mutahi Kagwe. And I begin with you, Dr. Mercy. Today's confirmation and the other information that came through. 111 cases have been tested. Right. 23 others have been quarantined, being observed. And probably tonight as we go to bed, there might be an announcement tomorrow. But the 4 cases, your analysis last week and this week, and we only have 4 cases. Yes.
So, Ken, it's important to start, I feel, on a note of optimism. And when you were introducing the show, you mentioned that Kenya is in the right direction. And I'd like to echo those sentiments that you've shared. Indeed, we're in the right direction because our president, His Excellency Uhuru Kenyatta, is being lauded for being one of the only African presidents to take a very decisive move. The interventions that you've seen directed through the National Emergency Response Committee are interventions that require a fight response, are interventions that are actually going to help us contain these cases. So yes, indeed, today the CS, Mutahi Kagwe, did announce the 4th case. And again, it was important for us to be able to understand that these cases are in stable condition. And the monitoring and how do I say, the ability of the system to be able to detect these cases is a testament to the resilience in the system and in the efforts that the government is making in trying to track these cases. So we are doing well, Ken, and I'm just trying to say optimism is useful and relevant in such a situation, and to emphasize that Kenya is in the right direction. We are actually going to be featuring in global media very soon, and our president will be featuring for making very decisive moves, and he's being lauded for that.
I'd like to talk about that decisive move in the next few minutes, but let me have the analysis of Dr. Otuoma. You have had what has happened, 4 cases reported. The first one was last week, I think on the 12th, right? And today there's another case that has been reported. Overnight we might hear, because there are 23 who've been quarantined, there are more reports. Your analysis of our situation so far?
I think our situation so far has been informative. At least the general public, as maybe you are looking at Twitter, everybody is aware that there's a problem called coronavirus. Now, I can divide that into 2. There's that social aspect of it, and then there's the medical aspect of it that we need to look at how well the country is prepared. And I think maybe they're in a better position to comment on what the government has done. But as a citizen and somebody who also understands on how some of these zoonotic diseases or epidemiologies really present themselves, we are looking at certain indicators to really see how well we are prepared. Where I sit currently, I'm seeing that on the social side, we are doing very well. Yeah, but on the medical side is what also needs to be very clear as to how well prepared the country is, and maybe they'll be in a better position to comment on that, because you can make pronouncements on certain policies, but if you look at how even the disease spread itself, if you just look at the genesis of the whole problem, in that province they are calling in China Wuhan or something like that, Wuhan. All the time with epidemiologies, you look at the cause, the source, how did it start? Then you start looking at how it spread. And then definitely the issue of how you can contain it and how you can treat it then will come into place. And we must be analyzing all those parameters as we speak, because this is not just a political decision. This is a highly professional decision that you need input in terms for you, even for the government to be able to formulate the right policies. So you must be saying that the information that is coming from the scientific community, the professionals, is adequate enough for the policymakers to make a decision. Okay. Because sometimes it can be a contradiction when we say we need a lockdown. And then you remember the other day, and I'm happy that maybe later it was realized that even children who are confined in boarding schools, it will not just have been an umbrella to say move and go back home. Because that one you are promoting or prompting mass movement of people, millions of people, parents, students, who are already in some areas. So you must also be having adequate plans that as we say we want to move these groups that are already confined, how do they move? Okay. Because it will be almost be counterproductive to your policy of saying, you know, you are quarantined.
Yes.
Because you are quarantined, and then here, in the part of making some of the decisions, you are also promoting mass movement of people. Okay. If it is not properly controlled, because later I heard that the public transport had to be specific,
and even
school
today,
buses
had further announcements on that.
But initially when it was announced, it was not very clear. So that took some of us aback and say, how do you get somebody from Maranda to transit from Kisumu, Nakuru, Nairobi, maybe to Mombasa on public transport, their parents? You know, that is almost millions of Kenyans.
Probably we'll have to specifically discuss those kind of intervention and if they were counterproductive or try and get into the thinking of the policymakers. I'll come back to that. But Dr. Omar Oluga, always present in the hospital, your analogy of what has been happening in the last few days and the announcements.
Yeah, I think I'll agree that the last 2 weeks the ministry and generally the whole country has been very aggressive, and those are very laudable steps. I think the closure of schools, the measures that were taken in terms of preparing isolations, there's been efforts by the president and also the cabinet secretary to really inform the public, and then that's really commendable to sort of cause calm in terms of the public. But also, on the other hand, there are also fundamental questions that are still coming from wananchi. I think that what the general citizens need to know is that we are in a crisis together. So it's not where, and this is especially for us, I've said this, it's not that whether one party is right and another party is wrong. It's like we are all trying to put effort together to keep ourselves safe. Of course, with the confirmation of one more case today, my own thinking is that there may be or there will be more cases. Before we confirm the case, I think I was on record saying that it's a matter of when. When 100 countries are already affected, I think it was just a matter of when. And even now, my own projection is that we may see a rise in cases. I don't think that should shock us. What we really need to do is to look at how do we respond to the people. And there's also something unique about the cases that we are seeing, is that they're Kenyans. You know, other countries started seeing cases that are not Kenyans. They, you know, either Italians or they're not their citizens. I mean, so that's also important. But fundamentally, also for me, that I have to mention is I have seen a lot of efforts. For example, today and yesterday, in terms of training health workers. There was a concern yesterday about giving them materials for protection, which I think there are still huge gaps, whether the gaps are in the supply chain or the shortages globally. I think we have to take very keen note, which is not very good, that health workers as at today still have concerns of being protected. And I believe that the ministry is working on that, because if you know, when a patient presents, they will not necessarily present at the isolation center. They will present somewhere in Mombasa or somewhere in Kisumu or somewhere in Mandera, where the health worker has not been trained.
But
and
I'd
they
like
do
to
not
specifically talk about preparedness. I just wanted to clear this, because you have said it should not shock us that there could be many cases. Arising from what? Perhaps that's the question. Arising from the people who have been tested, the people who have been isolated. Arising from what?
So, Ken, coronavirus, COVID-19, is a new virus, and it's a virus that's being studied, and scientists across the world are trying to understand how it works. And so far, the data that we have from China and Italy and the heavy burden countries, the data is showing us that every time you have one confirmed case, that this case is bound to reproduce across to 2 people.
Minimum 2?
Yes, at least a minimum of 2. The heartbeat is that these facts are not, you know, how do I say, 100% certified, because it's a new disease and we are learning. And so, as Dr. Luga has said, it should not surprise us should we have more positive cases. In fact, if anything, it should be assigned towards our agility in the system in trying to detect these cases and ensure that they're properly managed. As the situation evolves, we are monitoring and seeing how the graphs rose and descended in different countries. And it's almost likely from the epidemiology, as Honorable MP here has said, that this is bound to see an incline and then a decline. And so what is important for Kenyans to understand is all this raft of measures that have been put in place by the President and that are being stewarded by the CS Health is to attempt to actually have this rise and fall broadened to reduce the number of new infections.
It's bound to rise. It has to rise. That's it.
The way the epidemiology is looking like in all the countries that are affected, that's the trend. That's what the science and numbers are telling us.
Okay. Dr. Otuoma, where do you believe, before we get to the preparedness, where do you believe we dropped the ball? Because at first there was a lot of call for vigilance, even at our airports. I just want to, I want to get this out of the way, because even Kenyans are asking, if you see the social trends, and that's where we start, could there have been something that we should have done? Because Dr. Luga says it's on record. It was not a matter of if, it was when, and the when came last week, right? Probably earlier, 5th. Yeah. So do you think we dropped the ball somewhere?
No, I think, to me, if you are to look at it scientifically, when you describe any epidemiology, you look at the source. Where is the source? In this case, it was assumed that the epicenter or the main source of this problem was China. And in China, how it developed is like it came from animals, and then through either some food chain to human beings. And then now, if that was the epicenter, you have to look at it that most likely the kind of habits that we have here are not the same habits that are there in China. But once it has been transmitted into another human being, then it means you are in contact. And as you are putting it, the way it is being spread, which is now understood, either through saliva or some kind of contact. So we have to look at it that Kenya, we live in a global village. And initially, there was a lot of concern when we said, now it was from China, how do we control? And you remember there was quite a bit of issues
about it.
Yeah, even in terms of some planes coming from China, whether that was the right policy. But like every other emergency, as I said earlier, it depends on these technical experts, how they are able to advise the policy makers to be able now to put measures in place. In our own laws here, we have got what we call notifiable diseases. Immediately, those notifiable diseases, it means immediately they are spotted by an expert, you have to notify or inform the authority. So in that case, that is what we need to look at, that if we are only having maybe these few cases that came about, was it because of entries from outside? And if these entries, as he's putting it, that majority of the people so far diagnosed are Kenyans, then the whole issue would have been, how are we to handle Kenyans who are coming back into their country? You remember South Africa had to send a plane in Wangyung despite the close down to pick their citizens.
Yes.
In Kenya here, we have also been having appeals of people who are stuck there. So the whole issue is how we look at that whole chain and say that these were Kenyans, it's not foreigners who are being diagnosed.
Would you have looked at it differently if it was a foreigner, Dr.
Maybe if it was a foreigner coming from China, to me it would be, I would have looked at it differently, because we would be saying there has been reported cases of this problem.
Why did you still allow
why did
and asked probably
why did you, because that
Yeah.
would have already told you that this is a high risk area.
Yeah.
But if it's a Kenyan coming through, then by law he's supposed to come back to his country. Now the whole area goes back to the professionals, is that how prepared were we to handle those cases, so that they are now not coming and going into the general population, that as they enter into the country, we are able to confine them, within certain areas where the entry points. That's why you look at even all our airports, at the entry points. There's sometimes all these checks and balances, not just because of the corona outbreak, but you hear sometimes even you can't bring in certain animal products. You can't, you must have this kind of vaccination and all this. So those measures are in place. But now in this case of an outbreak, the issue is how well prepared were we to say that if the citizens are coming back, we don't allow them into general population. There has been this story, maybe just to finish, of some Kenyan citizen who has been saying maybe she's not positive or she is positive, and who did you get in contact with, and now you have to run around and look for those you see, that is reactive. Yeah, but now how we correct that situation and now manage the situation, or that's what matters.
Okay, like I said, I know you want to intervene, but even as you intervene, how has the fact that this is a Kenyan, the first case, patient zero, how has it changed the narrative that was being put out there in terms of foreigners coming to the country? How has it changed the narrative?
Yeah, first, you know, I think the discussion about COVID-19 has been there for almost 3 months. And initially when we were going on air, including myself, we were telling people not to discriminate on foreigners. You saw the video of a Chinese
on the street.
Being harassed in the street. I think there have been a few other cases where they felt a bit harassed. And that was the narrative. And I think it's related to what Mheshimiwa is saying. Initially, we thought that China was the place to worry about. So now look at the first case, the patient zero, traveled from the US.
London, Kenya.
US, London, Kenya. So again, if you look at the whole of Europe, again, Italy, Spain had more cases. So you wouldn't really suspect London that much, even though they also had the cases then. And then US also, you wouldn't suspect them that much. So this is part of what the world grappled with, because it took time for Italy to be declared an epicenter, and then it took even more time for the whole of Europe to be declared an epicenter. So the cases that we're going to be seeing, because we locked out, for example, China, and the public outcry initially was more about the Chinese plane that landed. And then we were leaving everyone else, including people coming from South Africa. At that time, South Africa already had 17 cases. So that's why in my own projection, I think that we took the correct measures, but also, of course, we took them late. It's not that we could have taken them earlier. Also looking at the economic situation in this country, and you mentioned it in your introduction, it is a very difficult balance for any country, especially countries like ours. You know, also look at the economic reserves in those other countries. So if you're going to really lock down this country, then people must also be aware of the consequences of that. So food, security issues, social amenities, personal effect. So there's a lot more in terms of also economic loss, jobs that are going to go down. So I think there's a lot more to look at. So I wouldn't really blame the actions that were taken late then. Of course, the one for Chinese, I think the public outcry was good, and then the action started to happen. And that's also the time that I think the cabinet secretary was changing. But since that time, I think the measures have been right. So for now, I suppose we are going to be dealing with many cases that were coming from other regions that initially the whole world did not think about.
All right, ladies and gentlemen, we have to take a short commercial break, but we are coming back. And even as we say that, now that you mentioned the cabinet secretary was changing, I remember attending that press conference, and as CS Cecily Kariuki walked out and Mutai, one thing that Cecily told me clearly at that time is, Ken, we shouldn't be worried about China, worry about Europe and Americas. So it's come to pass. Right, time for, yes, and even today the CS affirmed that they have adequate arrangements for goods that are coming from China still come in the country, so long as there's intervention on both sides. So, all right, so let's take a break. We are back now, and when we come back, let's discuss about the level of our preparedness, the response, the treatments, and even the training of the medical personnel, as Oluga has alluded to. Let's take a break. We'll be back.
automated parking system, you can now pay for parking in 3 stress-free ways. Using M-Pesa through the USSD code *486*12#, or using cash at the CAPS payment points located in the parkings, or using your preloaded CAPS A card. No payment will be done at the exits.
It's 8:52 in the morning. Living with S is the perfect destination for information, entertainment, and laughter, bringing a refreshing perspective to Kenyan television every weekday morning. Let's get revving. Welcome to Sun City Resort, South Africa. We create an environment that leads to moments of unpredictable fun that reflect on everyday people, celebrities, and experts in various fields that touch on your day-to-day lifestyle. So why not join me, Sharon Mundia, every weekday morning from 9 a.m. to 10 a.m. as I seek to liven up your morning.
I think what the government spokesman yesterday was talking about are the 3 cases that we already have, not 3 cases expected. Because suspected, everybody is suspected, We have urged our people, and we will continue to urge Kenyans, please stay away where people are congregating. May there be weddings, may there be funerals, may there be religious congregations, may there be nightclubs, may there be churches. Please, please, we appeal to you.
That would be a really difficult task, ladies and gentlemen, for the kind of society that we have, and not to attend funerals, weddings, and church. I think the emphasis should go on what kind of intervention we have in these places, like churches are now washing hands, giving the sanitizers and all. So that would be a difficult task. But let's talk about our preparedness right now and the kind of response. We have, you said that we wouldn't have done anything further than we have done right now, even then when these calls came. But the kind of response that we have, the first concern is that a lot of people were saying they're making calls, 1 to the 719, I think. Apart from that, the mobile numbers that were provided, the CS himself said, have got so many calls.
Yes.
And the intervention is slow. I mean, if those are response team, and that's what I'm looking for from you, what kind of response team do you have that can be called for 4 hours and they will not respond? What is the fear? Why are they not going to the ground?
So Ken, 2 things. The first comment on the level of preparedness, I think it's important that I shed some light as to how some of these patients present and how the disease evolves in the patients. Again, rightly so, we must use data and we must learn from the different countries in terms of how the situation has evolved there. In China, we are told that sometimes the incubation period, the period it takes before a patient is being seen to have, the runny nose and the cough and the difficulty in breathing, can range between 5 to 7 days. Now, the screening measures that were put in place, and this is just in reference to the prior discussion we had, were screening measures that were endorsed by WHO, and were screening measures that primarily targeted, and the thermal scanners. So what happens is that a patient can actually pass through when you have a normal temperature before you've actually started presenting these symptoms. And so to say that we may not have been prepared is actually incorrect, or is inaccurate, because this disease is a disease that some patients are coming in and not presenting up until the 5th day or the 10th day. But then you've raised an important point in terms of preparedness, and you've raised an important point in terms of dispatching rapid response teams. What the ministry is doing is listening to Kenyans, hearing the cry in terms of needing teams to respond rapidly. And so within the last 1 week, we've actually mobilized more team members. We've gotten into engagements with the Red Cross. So Red Cross has given us numbers in terms of response. AMREF has given us another 60,000 team members strong.
Across the country?
Exactly, across the country. And then through national and county collaboration, we actually now have what we are calling county corona committees in all the 47 counties. And these county corona committees have mobilized the health workers in all those 47 counties. And these are committees that are actually being chaired by governors. I'm happy to say that counties have even gone further and put in place call lines and toll-free lines that are county-based. So the 719 number is the number that is being manned nationally. And it's a number that's been manned, again, in collaboration with our partners. Safaricom has come in together, and all the telcos have come in together to support that initiative. Again, in response to the need for us to be more agile and faster, we've now engaged a subset of medical practitioners who are going to come in and sit in that call center. So now we've launched and expanded the call center, and we'll actually have
medical
exactly. So beyond having just the call center operators, we are now having the Kenya Medical Association bringing in a number of doctors who will be sitting there at the call center and responding to Kenya's needs. And then through Red Cross and AMREF, we've managed to get a pool set of ambulances that very soon will be able to respond across the county. So we are mobilizing and trying to get this resource basket larger and more proactive.
How many are we talking about in terms of numbers? Let me call them fast responders.
Yeah,
so how many?
So in terms of fast responders, how we're organizing it is we're doing it in clusters. So we've divided the country into clusters and regions, and using the Red Cross, should I say, distribution network, because you know Red Cross is a big quick responder all over, exactly. Yes. So that's infrastructure that we are using primarily. The good thing is counties have come in and said that they're actually going to try and buttress this infrastructure along with the different other facilities that they have within the counties. And most recently, the president has also tasked the Ministry of Interior to form part of this structure and help us in response.
So what is the number? I'm looking at the number across the country.
So in terms of hard numbers, I wouldn't be able to give you, we have 1,000 live bodies, because what we've done is we've clustered them and we keep getting incremental support to it.
So I don't have a static number. But you mentioned specifically what AMREF has given, 60,000.
So AMREF, yes. So AMREF has given us 60,000 community health volunteers. Okay. So these are community-based volunteers who are active, and they'll go to different households. They'll be communicating with the community and trying to, try and put in place prevention messages, and also alert us when there's need to respond. Okay. And that's the tier level, that's the base level for the community health volunteer. Beyond that then now is the national and county structure, where we are having all the health workers being mobilized in teams to be able to respond.
So in other words, we don't have a definite number, 200,000, 300,000, half a million put on this.
No,
we don't have
that definite number.
Okay. Yeah. Okay. Dr. What difference would it make if the government decided to message this differently? For example, in local languages. And do you think that's something that they need to do, because it's not being mentioned by anyone?
Yeah, I think at this time, and as I had said earlier, in terms of awareness that there is a problem, I think the general public is aware there is something called corona. But how they are now able to respond in terms of behavioral and cultural change is an issue. Because I was just seeing even something as I was coming on the news, and somebody was saying, what is this, border rider, my job is to carry people, is not to check whether somebody has got a problem or not. Now that automatically tells you that that kind of population that is interacting with the other population in terms of communication and all that needs to be reached. And how we are able now to use the numbers that you are talking about that they have been mobilized. Are they actively out there, or are they waiting for a problem to come? I will share with you a little bit on what happened in China, if you allow me, and if time allows. Because if you look at what happened in, is it Wuhan? Wuhan. Yes. You remember there was a social group of medical doctors, young people, who identified this problem.
Yes,
right at the beginning. Yeah, quite at the beginning. And they started talking about it. Yes. And the local authority was informed. But in terms of now informing the national government, And that response took quite a bit of time. In fact, I think that group was even being told to be spreading rumors and malicious and things like that.
And the whistleblower died.
And the whistleblower ended up being a victim of this whole thing. So in our situation, we also need to avoid that kind of situation, to be sure that information is being communicated properly, especially on the professional side. Because on the social side, I think there's quite a bit that has been covered. Now, how that interfaces with the profession so that we get a proper, the desired outcome, to me, that is where I'm seeing the biggest challenge. Because we have talked of all those numbers. Now, how they are able to transform and really relate to what we are trying to sort out becomes an issue. Another thing, Ken Mijungu, if you want to look at this problem, how it came about even in China, it was because of behavioral change. There was a time China was undergoing a lot of famine. So people started eating everything. And in the process, that is now where you find that a population started reaching out to even species or whatever animals that they were not eating. People today say Chinese eat everything, but you must go back and find out why. Even if you go to Korea, you go to Japan. There was a time there was a very big famine in those areas. I'm surprised sometimes we go there and I see things we see as weeds here. It's serious food in those places. So this disease then came in. So changing behavior is what I'm trying to put.
Have we really found the source of this disease? Have we done that?
I mean, it's been linked to bats, and then it changed a bit
so that's,
to a
that's a definite link.
and then
Because I just cut him short. That's a definite link.
That's a definite link.
Okay.
Yeah. That's a definite link that currently is suspected from bats then to one of the animals that which the human beings ended up either interacting with and consuming. And even the current outbreak, if you look at where it started from, that market is where they do a lot of these wild animal
So when you hear the numbers that she has floated around, you think we are in the right direction in terms of getting ready for even an explosion in terms of the number of patients?
You know, those numbers look encouraging, like when you talk about 60,000.
Yes.
But then we should also be saying, how is it going to be interacting with the population?
Okay.
Are they in centers? Do you expect the population to go there? Or are they going to be at where the person who was talking today, this Boda who was saying, how will I stop working? You know, balancing between the commercial and the need maybe to quarantine and take care is what we really need to work on.
Okay. Dr. That was a concern of one of the eminent persons in this community, that's Professor Levi Obonyo, who's wanted to know, why are we not messaging this right and taking it to the village? Perhaps in Migori or Kisumu, I like to hear more messages in Kijaluo, for example. In Central Kenya, I like to hear more messages. And perhaps that's government, but I'll ask you also how that is going to help.
I saw Governor Lonyangapuo saying that all the things that the Ministry of Health are saying, they as a county will translate it into Pokot.
That is understandable.
And put it in the local languages. So I suppose what she's calling the county corona teams, this should be part of the, the mandate to sort of spread the information locally. I think Professor Levy is very right. I think we need to reach out quite clearly to every single Kenyan in the means that they understand best, because also there is a concern. We have our brothers and sisters also who are living with disabilities, either hearing disabilities or speaking disabilities, or they also they cannot see, sight disabilities. So they also need to be reached, because equally they are exposed. They also need to take care of the hygiene. They also need to keep social distance and all this. But fundamentally, I want to get back to what she's saying. I think the measures that have been taken, especially bringing more partners on board, actually is quite commendable. I just want to go back to the practical steps. And now that she's here, I think I would specifically talk for the health workers. You know, practically for a health worker, you may do a lot of messaging, and I think Mheshimiwa said the social things are being done very well. I think the infrastructure was also that there was an isolation. But now practically, if I am a nurse or a doctor or a watchman or a sweeper in a hospital or someone working in the laboratory, what I would want to be done is, number one, that I should be equipped with the correct knowledge. So there's a lot of things that are going on in terms of understanding the science of the virus. There's a lot of also other things that are going on in terms of how to manage it. So there's all these trials going on. I think what we have not done here in Kenya is to have a clear clinical management protocol that every single nurse, every single doctor, every single clinical officer, a laboratory scientist, or even from the triage, even from the watchman, should know that this is the management. And this is not necessarily the kind of message about keeping distance, about droplet transmission, about cough and sneeze hygiene. This is specifically now in a hospital. What should I do with every single patient who is presenting like this? And the same should happen with, as you said, community health workers, so that there is a guideline for communication, but then there is also a guideline for management. So this has not been done in terms of sensitization, so that we have those protocols very clearly in every single consultation room. The second thing also, which is a big concern for health workers, Kenyatta National Hospital, Mbagathi, and every single place, is I still have my bare hands. I think some of the county governments do not even have quality gloves, for example. They don't have masks, they don't have the gowns and the gumboots. For healthcare workers, what we would recommend is a bit more protective measures rather than just the mask and the gloves, and because especially those who are going to be taking care of the patients. What we have seen in Italy, in Spain, and China, and even the US, that a significant number of health workers who take care of these patients also get sick, actually 20%. And some of them have even died. You mentioned the whistleblower, the hospital director. In the US also we are seeing a bit more aggressive disease in the health workers who actually contracted from the patients who first came to hospital. So for me, it's quite a huge concern. So we recommend that there should be holding rooms in all facilities.
Okay.
And these holding rooms, what they're supposed to do is that there's a specific team that should be designated, of course, to see the patients, but everyone should be aware of what to do, because these patients do not just go to that team. They start from the watchman, they come all the way, even the accountants and the administrators in hospitals, you know. So these holding rooms are supposed to help the health workers who have come into contact, so that they can work for like 7 days, and then themselves they are quarantined for another 2 weeks.
Okay.
You know, now during this time that they are quarantined, because they are not in contact with their families, you have to have a reserve of health workforce. That's why we were very pleased when the president announced that there will be additional health workforce. And we, of course, immediately said there are a lot of doctors and nurses that we can mobilize. And I think this is something that is very key, because those practical steps is what we will see our curve flatten. Because so far we may see the rise, and we, of course, the community measures are very important, the preventive measures are very important, but the practical steps in hospitals to prevent spread. If you are a nurse or a doctor and you are seeing 100 people, and then the first case came, like you saw a patient who later had COVID-19, but the 99 others have also been exposed. So even if you are quarantined, remember there are 99 other people who are
out of the 99
who went home. You know, so these are real challenges that need to be addressed.
I think I need to ask this question to Daktari here, but this is something that also Kenyans have been speaking about on social media, and if Jackson, you could just put it on the screen. This is from Herman Manyora. He says what the CS, people like the CS don't know is that when we get to 20, because you said this is possible, 20 or 30 corona cases in the country, no plane will be allowed to land anywhere in the world. Not even poor, miserable countries will be stuck here with ourselves.
Yeah, it has a huge economic impact. It has, I think, you know, now it's a world problem. So all over the world, including the US, they have they've declared state of emergency. So every country is dealing with this. So I think at this particular point, I understand what Prof is saying, and we should look at it from the economic impact.
Okay.
But from from a shame perspective, I don't think it has any value because every country is dealing
is involved with this.
Right.
Over 100 countries. Dr. Let me ask you this before I go to Dr. Tuoma. The panic, and let me say tomorrow we wake up and there's mass symptoms in this country. We're talking about 2 million from across 47 counties. There are calls, you've said there's a call center and all. Are we able to handle it just in a very short answer?
Right.
Do you think we are able, tomorrow people are coughing all over and having chest pains and fever all over?
Right. So Ken, allow me to dispel that and say, again, from data, because again, we always work with data. It's unlikely that you would get 2 million cases.
Okay.
But then what is likely is that if we do not continue enhancing our responses, the system will buckle. That one, we are clearly aware of that, and that's why you're seeing the measures that are under play. It's important what Dr. Oluga has said. The president has been able to amass more resources, both in terms of financial resourcing, but even human capital, to ensure that all the armies, all the soldiers are on the ground working to mitigate this. So with more sustained response and with more collaboration, I think we'll be able to mitigate this.
Okay. There are many health workers who are asking me, where do they apply to work? Because I think the president announced, but we have not seen any one said, go to this hospital, register so that you can
and Dr. here you're talking about qualified graduated, we're not talking about trainees.
Yeah, we are not talking about the 60,000, we're talking about doctors who are qualified graduated.
Okay.
Yeah.
Dr.
I think Ken Oluga has explained it very well in terms of what I was now talking about, the professionals, what they are doing, the mitigating factors, the way they are coming up with, and the way you have explained it, that's what needs to be done. Because as I said, I've been seeing quite a bit on the social side, but on this other side, which is the real, I can say the real barrier between this country and that disease, is the professional side. If you, without repeating the measures he has just talked about, that the professionals can be empowered, they can be given the tools to be able to intervene without again bringing in a backlash in terms of them being, again, the victims of this problem. And that then the economic aspect of it that you are talking about comes in place, because then they'll be saying, the kind of pool that you are having in terms of disease is so dangerous for you to communicate with the rest of the world. It means you have not put in proper mitigation measures. So even just from the economic, other than the health angle, it is so critical that our medical profession is empowered and they are able to put in measure those aspects that you have talked about.
At this point, I think I need to respond to this and perhaps also share what has been happening. It's a dynamic situation, and like I said at the beginning, probably about 2 weeks ago, we've been able to bring along these medical professions themselves. And I think one of the beautiful things that we've learned is that collaboration is actually the new innovation. And that the ministry and as policy makers, we actually need to engage with the frontline health providers. And sometimes those spaces can be a little bit different. But the beauty of what is happening right now, as we speak, the whole day yesterday, we were working with medical teams from the University of Nairobi, with frontline workers from KNH, frontline workers from MTRH, and frontline workers from the counties. And so I'd like to let you know that we actually now do have clinical management protocols, all worked on collaboratively and actually led by the university, not the ministry, but led by the university. And then what's also special is the private sector, and I think this alludes to what Oluga was talking about with regards to how a patient flows in a facility. Again, in the past 2 days, through collaboration with the private sector, hospitals and providers, and I'll have you believe even some logistic planners, people who plan warehouses and how flows of goods and supply chains go, came to us and told us, perhaps you need to look at how the layout of the hospital can be changed to ensure that you have proper flow of normal patients, and then you have proper flow and directives right from the gate and even to the people who transport the patient as to how the patient flow should look like. And so just yesterday, actually, we were approving patient flow maps. And these are the maps that we will be sharing with our healthcare workers to allay fears. And remember, because it's a dynamic situation that's changing, and in any war, you deploy your battalions very strategically and sequentially.
And
very accurately. You don't just plunge your whole army into the battleground. You have to really be monitoring and have your situation room to be able to determine, okay, Battalion 1, go ahead. Battalion 2, go ahead. Battalion 3, you're in reserve, pump up, get ready to go to war. So I'm happy to say we do have those protocols. And I think what we need to do perhaps is the Ministry of Health, the CS, will be leading this process. He will be engaging with the union, with the doctors there. We've also set up an engagement with the Medical Association. And this engagement will be special because it's going to be led by the UN teams. Who develop these protocols and to share them with their providers.
All right.
Yeah, I think I can at least have been aware about the protocols. They've been discussed being yesterday. What I think needs to happen a bit quickly is the dissemination. Okay, basically validation, because they need to be published by the Ministry of Health.
That's true.
Which I think they have been developed, but they have not yet been published. And number two is the dissemination to all health workers, because so far I think maybe less than 10 of us, I think doctors know about it.
Okay.
Yeah, so you can imagine.
And it shouldn't. That's what I talked about in the intro. Being cagey, I mean, share your plan. Let's know, because this is not a secret that we're fighting. So that's really good. I'd like to take a break. I'm going to talk about the social responsibility of individuals, so that you shed light on this, because I think everyone is on board right now, but what are the specific roles that should be played? And I've also been sent some questions here that are very key by Nancy Booker, who's also a trainer. So I'd like to know, because she's asking me specifically, what is the role that community influencers, like teachers, like chiefs, the clergy church can do, right? But first, now that we have measured on the interventions and the preparedness in the hospital and what you talked about, Anita Nkonge actually did a story and she demonstrated exactly what happens in the hospital. So let's take a look at that, then we'll take a break and come back, because I really need also to tell Kenyans about the vaccine that was tested today in the US. All right, Anita Nkonge now.
Testing for COVID-19 is imperative in confirming symptoms and getting a timely diagnosis and treatment. So what exactly does the testing look like? Come with me.
For purposes of this simulation, I was a walk-in patient. Ideally, you're encouraged to call using the hotline. If the doctor believes you need to be tested, an ambulance would come pick you up and bring you to hospital. Once at the hospital, I was given a mask to put on before I explained my symptoms.
What we don't want to do is test asymptomatic people, people with no symptoms. Most people who don't have symptoms, even if they're incubating the virus, will test negative. So what that would do is give a false sense of assurance that somebody now is negative, and then they can still go on and transmit. So generally, the test should be done when symptoms develop.
I feel like I have the symptoms. I have a fever.
Have they been to a place or in contact with somebody within the last 14 days that they might have been exposed to COVID-19? Then the main two symptoms are fever and cough. The cough tends to be a deep cough from the chest, not an upper airway cough. And it's a bit hard to demonstrate the difference, but if you have one versus the other, you will know. They don't tend to have runny nose. That's very uncommon.
Once established that I met all the symptom requirements, I was then escorted into the isolation room. The room had negative air pressure, which means that the suction force in the room could not transmit any of my airborne particles.
Then the person collecting the test will put on appropriate protective equipment, and that will normally include a mask, goggles or an eye shield, the gown, and gloves.
The doctor then met me inquiring about my travel history and symptoms once more. And this is where it got interesting.
Then they will put the swab into the nasopharynx, which is way back in the nose. And the Ministry of Health is also collecting oropharyngeal swabs. So that's from the back of the throat. The most important one, though, is the nasopharyngeal, because that is where the highest number of virus particles will be.
Is that fine? Just gently, okay.
My sample will now be taken to the lab where it will take 1 or 2 days to get tested. Until then, I am advised to be in self-quarantine, which usually means isolating myself from most people and waiting until the lab results come out. Anita Nkonge, NTV.
Welcome to Press Pass.
Naangalia TV ninaona habari zangu.
Napata news updates kutoka Google.
Sana sana online inakuwa sawa sawa.
Are we ready to transfer that audience?
People don't really trust social media. They will always go back to the traditional media sources.
The bashing of the media has become fashionable.
I was chased from the field because of politics. He says, "Wapi mtu ya gazeti, a nation." I innocently lifted my hand. And I threw the room at me.
I am Mark Masai, the bald, shiny man who brings you Press Pass every week.
Press Pass. Accountability to the Fourth Estate.
In order for us to mitigate loss being suffered by our economy, there is coronavirus. After coronavirus, there will still be Kenya and there will still be the world. And in order for us not to suffer extreme economic losses, we have considered and found ways of ensuring that cargo vessels, cargo aircrafts or ships, can come into the country provided they are disinfected at the point of departure and the crew quarantined on arrival. In order for us to mitigate loss being suffered by our economy, there is coronavirus. After coronavirus, there will still be Kenya and there will still be the world. And in order for us not to suffer extreme economic losses, we have considered and found ways of ensuring that cargo vessels, cargo aircrafts or ships can come into the country provided they are disinfected at the point of departure and the crew quarantined on arrival.
All right, I think that Tari explained that to us because you're standing right there with the CS. What are these legal documents? Because my imagination is what I usually find at the airport. Are there additional documentation we are taken through?
So what we've done is the CS has invoked, according to his mandate, the Public Health Act. And the Public Health Act is an act that makes provisions for the Cabinet Secretary of Health to be able to put in place interventions that may require, should I say, stepped up measures. And one of the key things we've noticed is that we have to ensure that quarantine is actually being undertaken by the citizen. Like Dr. Luga rightly put it, for us to flatten that curve, we need to deploy all the measures that we can. And one of the measures that has worked is actually quarantine. And so what the CS was talking about is invoking the Public Health Act and making it mandatory to actually undertake a quarantine process. And so I don't have the document here with me today, but we'll be able to share that with you. I think when we get to the offices, we can share a soft copy with you. Okay. And the document ideally highlights citizen responsibility, as you mentioned. So if you're coming in and you're Kenyan and you're coming in from a country that's afflicted, that's high burden, and you're returning home, then you are mandated by law through the Public Health Act, as CS has invoked, to actually self-quarantine. And this document will involve getting information as to where you live, where you will be self-quarantining, how we will actually be able to supervise that self-quarantine measure, and how you actually hold yourself liable to any breach of that self-quarantine. And it's important to note that this is one of the tools that has actually been utilized in France. I'm not sure if you're aware, but just a few hours ago, the president in France actually instituted the same orders, and there's actually a penalty. He actually said it will be a punishable crime if you breach quarantine measures.
And it's no longer optional.
It's no longer optional. This is mandatory.
In some countries, actually, that is a standard. You declare where you're going to be, which hotel you're going to stay at, who you're visiting, if you're going to be moving around to what office. So now that you've explained that, Nancy Booker wants to know, and Dr. explained before I go to Dr. here to, now you're all Dr. Okay, you'll explain to me this. A lot of people don't understand what quarantine means. Can you break it down to us? When you say, Ken, self-quarantine, what do you mean? I cannot go to the shop, I cannot meet people. What does it mean?
So self-quarantine means that you keep your yourself without the interaction of other people, including family. So it's quite a difficult thing, but you have to institute. That's why it requires self-discipline, because what it means is that from the time you are going to the airport and you perhaps call home, you're going to go to a specific room. Yeah, and I think then you can just stay there. Especially if you are in a place where there are many. But some other people also quarantine themselves as a family. Yeah, especially if you are traveling together or not. Yeah, but that's exactly what self-quarantine means, that you are taking a measure not to interact with members of the public, and specifically sometimes including your family.
And this is a noble thing. You know, people might look at it as punishment, as a small prison, but it's a noble thing, because you're not only protecting the people outside, but you're protecting the family. Right here at Nation, I know we've taken measures to prevent anything that could happen to the rest of us. You can even see the kind of distance they're giving us. So explain that also, the importance of this, because people will look at it. Why do you want me to stay indoors in my bedroom? I need to go to the sitting room. I need to sit with my family in the dining.
It's because now if you're looking at the science of the virus takes about 5 days to start causing symptoms, sometimes even up to 10, 14 days to start causing symptoms. But even during that time, when the virus is multiplying in number before it overwhelms your body and it starts causing the symptoms, you can actually still spread it. Although the spread is more during when you have symptoms, when you're coughing or sneezing. That's why also the social distance is important. So you put just an arm's length and the other person can put an arm's length. So that's good distance. If you can stretch your arm and the other person stretches.
So as we're good here?
I think we're good. This is good. So because 2 meters is good, of course, practicality, we can even say
even if you were to cough,
so even if you were to cough, because those droplets are presumed to be heavy. Of course, we can't see them, but scientifically they are presumed to be heavy, so they don't go far. So it's either when you're talking, coughing, sneezing, and then when you touch surfaces, people who have either coughed, sneezed, then it's now in your hand, then you touch your nose, your face. So it's
what is that about membrane?
It's actually about the nose and then the mouth more than the eyes. Yeah, because it's something that you inhale. So the hair in the nose or the mouth, it takes it down. And then, so like for example, the mouth, when it gets to your throat, then now it goes to the respiratory system, can come up. So this is really the reason why hygiene is very important. You remember that it also stays on surfaces, 24 hours to up to 3 days on surfaces. It can stay.
So if you left something here, if we don't sanitize this place, 24 hours, we're talking about Thursday night,
even
Friday night.
So it depends on the kind of surface. For example, paper surfaces, it can take up to, that's why 24 hours. That's why we recommend use of tissue that you dispose properly. Yeah, that proper disposal of the tissue is also very important. So that's why tissue, so for example, paper surfaces can stay up to 24 hours. Plastic surfaces and other metals can stay up to 3 days. So you really have to keep
that cleaning. Once we disinfect, how long does it take for the virus to die? do around here right now?
The virus is shed off very fast, and that's why cleaning with running water. So the primary thing is still running water and soap.
And soap. Okay.
So running water and soap. But of course, sanitization with any disinfectant that has alcohol content more than 70%.
Okay,
yeah,
it's good.
So that is really good. So these are very key measures that people need.
Social responsibility. Yeah. I still want to get your own perspective on that kind of social responsibility. But Daktari, before I forget this, the power of community. You're a community influencer, right? You make impact, you stand and speak, people listen to you. What is your place? The doctors, the teachers, and who are we likely to target? The ministry should be, who should the minister be talking to right now?
I think she had alluded earlier that it's the responsibility of every Kenyan to be able to give the right message, especially those who can message properly without distorting the message. If you come to politicians, community leaders, opinion leaders, it is very easy sometimes for people to believe you. Like what you said, Governor Lanyonga Puo, saying that I want this thing in Pokot, so that people understand. Because you must also understand, in Africa there's that cultural aspect where somebody will just come up with outrageous thing and they say, no, this is not the problem. The problem is Chira, or the problem is Muganga or witch or something like that. And you have had some purported leaders, you know, uttering those kind of things. So it will be very important that we bring those people on board, so that everybody who is speaking, it becomes a national psyche, that we have got a national crisis, and it is a responsibility for all of us to impart the right information to the population. So that today when I see a boda saying, it doesn't matter to me, we must be concerned to say, come of it. You said there are some 60,000 community workers. This place needs somebody, and that's why we have got that number that they have put in place, so that everybody is passing the right information. And as you have heard, maybe before he talks, this is almost like a contact disease. Yeah, it is not so much maybe like airborne. So when you talk about that social responsibility of modifying behavior on how we are interacting with each other, people should not make a mockery of these distances that we are talking about, so that somebody knows that if I cough, you know, how far can my saliva go? And or if I sneeze, how far can it go? Because that's when you get the problem. Immediately the population can internalize that kind of modification in behavior, then they know there is a purpose. If somebody has just put on a helmet on a motorbike, then again you are giving somebody else before you sanitize, and you have been told even simple alcohol can do that. But you find sometimes now the population saying you should drink
the more you drink and stay drunk the whole
but
day.
that is not
That's
the whole thing. That's a distortion of the thing. So we need to make sure that those basics, in terms of that what the health workers are telling us, that communication is being reinforced. Because sometimes it cannot just be a one-off kind of communication. You know, people don't internalize things at the same rate. So we must constantly give that positive feedback to say you need to constantly be doing this right thing. In funerals, we have said, even this weekend I was shocked to see the kind of masses that are still going in there as if there's no problem. Another one was it on the day before they announced? You saw the panic in the supermarket. You are being told isolate, but here you are rushing to group and crowd in the supermarket. So these are the kind of social modification that we would expect Kenyans to understand and say, if I'm going to buy a sanitizer, I don't now again promote behavior that can even make me have a disease that I didn't have. We should be able ourselves to mitigate and say, no, why do I need to crowd? Why don't we even maybe let a few people go in as we stand outside isolated and others go? So those are things that we'll constantly continue to do as community leaders, and that is to everybody to modify behavior.
And churches are very important in this, because a lot of people go to church and these guys are believable. The clergy is believable. And I've seen a few try and do what is right. You
I interrupted Mheshimiwa. I think he mentioned the point, because in the morning I was being asked about the helmet, the sharing of the helmet, and you know, the specific sprays that we can use for the helmets. So like, I think those are important things, because you can't be washing the helmet. You know, we are talking about running what you can't. So you require it. So I think there needs to be some specific sprays which can even be methylated spirits and all that. So I think that was very important. The other thing he also mentioned, which is the behavior. Like we've seen people also trying to run-up country, or I don't know whether it's fake news, but we've been seeing a bit of concern that there are people who are running away, which is also in itself risky behavior. True. Because if they are already exposed, it means that they are transporting this disease to the rural areas. And also exposing those in the public transport system. So these are very concerns.
It could get to a stage where the government says, stay where you are. Don't leave. For the next 30 days, no one leaves.
True. And I think there's an important thing, maybe a call to action to influencers. We've had a number of influencers come to us in the ministry and want to engage with us in trying to pass this message. What would be useful would be perhaps to have Kenyans absorb this collective responsibility and have all the different players in the space. So we have the musicians. I'd love to see more of, musical jigs being done. We have Kenyans who are so good in comedy. I'd love to see us actually, make punchlines in terms of the behavior that's being demonstrated.
I just saw Felix Odua the other day. He took a whole video, probably 2-3 minutes, to demonstrate how you should be washing your hands.
Exactly.
I've seen the comedians talk about the face mask.
Exactly. And then also a key important thing, and both Daktaris have alluded to it. I think especially for, should I say, the middle class Kenyan citizen, it's their responsibility to be able to, should I say, work hand in hand with the whole country in actually spreading the message that simple water and panga soap is enough.
Yeah, you don't.
So you're seeing a lot of people running towards sanitizers, but the simplest of soaps and water is actually effective. Okay. And so sometimes how we react, you can imagine in the urban centers, when the rest of the country sees everyone rushing to the supermarkets, then you can imagine the fear, the panic it creates, especially amongst our struggling communities. So it's important for people to know and to remember, and the ministry is really going to be running a massive campaign on this in terms of hand washing is actually able to transmit risk of transmission by 45%. And it's that Kipanga soap, that sunlight bar.
That reminds me of something that happened in the late 90s comedy, when we had the John Carriers and Akina Nyambani. They once did a video before you do anything, nawa mikono. Remember that? Kabla upike, nawa mikono is as basic as that. And
even the World Washing Day.
It saves a lot of things.
But there's also an important element, Ken, in terms of citizen responsibility. It's a bit disappointing and shameful when you see certain groups of Kenyans trying to benefit from this scourge.
Like
we've heard of instances of people going to
prices?
Even spray houses, saying that they have this special indoor spray that's going to really take care of your house. We have different people peddling different testing kits across the market, and these kits are not even validated within the country. And then, of course, we have the hoarding of goods and then the hiking of prices. And the president has been really clear. It's ethically wrong to do this. As a baseline, it's ethically wrong. And so, again, collective responsibility is each and every Kenyan realizing that even when you buy 10 Dettol bars, you could still be very vulnerable, even if you use those 10 Dettol bars for yourself, and that it's actually a demonstration of selfishness. If you're holding
one could work as well as the 10. Exactly. Okay, so we have talked about a lot of gloom tonight. So there's also some good news. So I'd like to take you through the good news before we talk about some interventions, because I'd like you to talk about the testing that happened today in the US, how important that is, and the fact that people should not be holding their breath because of that, right? But let's take a look at this, and fears bound regarding the spread of the coronavirus. And while everyone takes precautionary measures, it's not entirely all doom and gloom. Let's have a look at these graphics right now. With the dramatic fall in cases, the last temporary coronavirus hospital in Wuhan, that's in China, closed last week. According to the Times of India, doctors in Rajasthan, if I'm not wrong, cured a patient of the virus using drugs which included antiretroviral drugs, just the normal ARVs, which are used for HIV-positive patients. Dutch scientists claim they have found the antibody against the coronavirus. This is potentially a huge discovery if it's true, but they say the development of anything useful will take months. The elderly are among some of the most vulnerable, we have been told. But get this, a 103-year-old female Chinese patient has recovered from the virus. She's the oldest person so far to recover. The other good news is 4 days ago, Apple, the big Apple, reopened its 42 retail stores in China. They had been closed since mid-February. Clinic in Cleveland, Ohio, that's in the US, says it has developed COVID-19 testing that can deliver results just in 8 hours as opposed to the 2 to 3 days that the testing happens. South Korea once had the highest number of cases, but they have dropped sharply. Now the plasma or the blood of the recovered coronavirus patients could be used to slow the spread of the virus, according to scientists at Johns Hopkins University. And you all know the reputation of that university. All right, very interesting. So there's some good news. There's some good news. So let's talk, on that note, let's talk just briefly.
I think it's important to say that scientists all over the world are really doing their best to try, but everything is experimental. Yeah, and that is why even for us, it is very important for our clinicians to come together and say, what are we going to do as Kenya? Yeah, so I think everyone is trying something elsewhere. Initially, Chinese were using chloroquine. There is the antiretroviral lopinavir. There is remdesivir that has also been tried. It was tried during Ebola. There is the issue of isolation of the antibodies. There are people trying vaccines, but everything is experimental. So that's a very key thing to say. So yes, we are also very delighted by the news coming, but it's still all experiment. It will still have to go through a lot of stages. Development of drug and vaccines, I think Daktari may be more vast there. Takes at a minimum 2 years and sometimes up to 10 years.
Okay.
Yeah.
So even if they were to get a breakthrough, we have to wait for 18 to 24 months to be certain that this is working.
Yeah,
That's what you're telling us.
and even currently, I think globally, I think it's only in China and Australia where they are able to reproduce this corona virus, the genotype and all that. And it is, let's say, like from those places that you'll be expecting quite a bit of experiments to be done. And I think currently it is Australia that is a little bit much more advanced, and they are yet even to test it on animals before they move to the humans. But if you look at what they are giving here, you know, these are drugs that are already available in the market, and you can experiment here and there.
And then they work.
And you can see whether it works or not. But the real, you know, vaccine production takes a bit of time. And then you must also look that pharmaceutical firms, a lot of them are not very keen in that area.
Developing. Is that what happened in 2002, 2004 during the SARS in China and MERS in Saudi Arabia? Because they dropped it, they began the research, and somehow they just stopped.
Yeah, but generally, if you look at the pharmaceutical industry, you know, they don't make a lot of money from vaccine production, because this will be a one-off thing, and yet, you know, the investment in terms of research is quite heavy. So unless the governments come in as a social responsibility, or certain foundations come in to support that, then they can be able to produce some of these vaccines. So it's not very encouraging for a lot of pharmaceutical firms, but because of social responsibility and everybody coming on board, I'm sure something can be done on this.
Oh, okay, okay. Now I understand why the vaccine on SARS and MERS was dropped. Because if
but it's also difficult. The SARS, MERS, and now this SARS-CoV-2. They are the more dangerous or the more virulent viruses in the whole coronavirus family. But also they also change very fast, or what we call mutation.
So you might find one for this and tomorrow is
even
totally
just
different.
the flu that is caused by also an influenza, for example, we have a vaccine for it, but you have to take it every year because the virus changes so fast. So this coronavirus family, they also change so fast. In fact, some of the viruses that cause flu, the rhinoviruses, the adenoviruses, the immunity, even when you produce the antibody that you were talking about, only takes 9 days. So after 9 days, it's gone. You can still get another flu. So these also are challenges in the development of the vaccine.
Ken, some other good news, and this is not on the medical side, but perhaps this is a lesson. This is a global lesson on how we, as a world, come together to engage with pandemics. This perhaps is a crucial financial lesson as to how this can form one of the many economic shocks. I think when we were studying economics, this was rarely defined as one of the probable causes of a recession, but now you can see different countries having to come up with mitigation factors, but then also perhaps a lesson at community and coming together and fighting together. I think there's also been key lessons in how the world can do this. And then perhaps even some elements of disruption. Could this be the beginning of how we live differently, and how perhaps we even have more independent lives, able to work from home, able to be more efficient in how we do things? I think there's a silver lining in all these lessons we're able to learn.
And strengthening our healthcare.
Of course,
I mentioned it right at the top. Time to rethink it.
Exactly.
I need to go to the cartoon of the week because it's a little bit, we lighten our discussion. But what I wanted to ask, CureVac, the German company, what happened? Because we were told yesterday that Trump was offering some money for it to relocate their services, especially for fighting coronavirus, to the US. I don't think this is really, how do I say it? But it would be so unfortunate if he was to do it. Was it true that he was trying to buy them out?
I'm not very much privy to that, but
it was news all over yesterday.
As I told you, the only ones that I knew of where serious experiments are being done is in China and Australia. This animal health laboratory corporation. That's where they are quite a bit advanced. And I think they're the only two labs globally that can produce corona.
Because even CDC, what they did is that some of the drugs that are already approved, I think you mentioned the antiretrovirals, the CDC, which is the US body that does a lot of research, they jumped it to phase 3.
True.
Exactly. So that's what they did. So they never started from the beginning.
They just went straight.
But I think also, Ken, before we get into the cartoon, it's important to note that China requires to be lauded for their efforts. China will actually be supporting the African CDC establishment and have actually greatly resourced it. And tomorrow they'll be sharing a comprehensive from beginning to end of their experience. And so they're holding a global conference with about 20 African countries in 20
in China or in the US?
It's going to be a global, should I say, teleconference.
Oh, teleconference.
Yes, and the Chinese scientists will actually now be releasing all their protocols.
We have Kenyans
for the country. Yes, so we do have Kenyans who will be participating.
Is that where you said the president will be?
No. This is a different. No, this is a different. Yes.
Okay.
Yes.
I read yesterday also that but 35 companies and academic institutions are involved in this, and about 4 are already experimenting on animals, like you mentioned. All right, let's lighten this, and the cartoon of the week, let's say it on our screens. Alternatives. I think this is very interesting, but it's real. This is how we should go. Okay, so let me begin, Dr. Luga. Which one catches your eye?
This hip bump.
We tried before I did. Okay. But there's one behind me here, Daktari, if you want to say it's good for us. That one catches your eye. But your general outlook of how this was represented.
Yeah, so I think what we've been doing is this elbow, at least for me.
Okay.
Yeah, the mercy you
I think the namaste is very calm and peaceful.
Okay.
Yes.
Here we did foot bump with Anita when she left Aga Khan. I didn't want to say to shake her hands. I did the foot. Dr. Otoma?
I think I'll go for the bow because, as we have said, the more you minimize any contact,
yes,
the better. So if we will just either wave or just both, or even, I think that should be cool enough.
Okay. So why you host the sidebar,
yes,
and you have discussed the handshake quite a bit. So why the word handshake alternative? why not the word greeting alternative?
Greeting alternative. Oh, nice. Or the last one, just keep your hands in your pocket.
Yeah,
exactly. Just keep your hands. It's caused us a lot of trouble because right here I walk out of the Nation Center during the day and everyone wants to shake your hand. And it helps also to work with the sanitizer, the small one in your pocket.
It does.
We met quite a number of people who do that. All right, away from that, let's see who said what for the week. And by the way, ladies and gentlemen, this is interesting. Let's take a look.
There seems to be a lot of confusion on how to correctly cough. Being a preschool teacher, this is something I do every single day. So I'm going to teach you how to correctly cough. We do not cough in our hands. So that means this is a no-no. The reason for that is when you cough into your hands like that, now you have germs all over your hands. And anything you touch will get your germs on it. So now you need to go wash your hands for 20 seconds with soap. When you cough, you need to use your cough pocket like this. See this? That's a cough pocket. Simple, easy to use. It's on your body. It's free. It's always with you. If you sneeze, you sneeze into your cough pocket. All right? So let's recap. Coughing to your hands is a no. That's a no. Coughing into your cough pocket, sneezing into your cough pocket is a yes. Now you know how to correctly keep yourself safe.
Well, I agree every bit with that lady. All right.
Sure.
Ladies and gentlemen, I'll give you the final opportunity to say something, and then we can end the show. I'll begin with you, Dr.
Yeah, so I think commendable work that has been done by the ministry. We have to recognize that our healthcare system has always had challenges. It's not that all of a sudden it's going to be better. I think I have been in the fight for some of these kind of things. But in the wake of this coronavirus pandemic, there are measures that have been taken that we can laud. What I think has not been done well, or that is still happening, I know today there's been a lot of trainings of health workers, and even in this week there's a series of trainings, is the sensitization. Of course, I do also understand that you may train, and I think Mheshimiwa mentioned it, you may train 1,000 health workers, but then the 1,000 health workers have not been given very clear instructions on how to go train the others. So you have 1,000 that have just disappeared, because then we have thousands of health workers. So I think for me, the issue about protecting health workers, giving health workers very practical guidelines on clinical work, and also sensitizing them generally, so that we have a common psyche, as Dr. Tuoma mentioned, is very important. And we are very much willing to work with you in terms of even those holding rooms, in terms of the reserve numbers. We really look forward to now an implementation of the President's announcement on where should these people go so that they can be employed. I think we really look forward to that. Yeah.
Okay. Well said, Dr. Tuoma.
I think I want to encourage Kenyans that we have had pandemics before in this world, and the human society has been able to overcome them. We had very serious problems in Europe during these early centuries. People died from fleas. You remember those bubonic plagues and all that, where our people here were being told to cut some rat's tails, and they never understood why. But it was a way of reducing the rat population so that you could control the fleas. So I'm just trying to say that these are challenges that humanity has experienced every now and then. Please just listen to what the professional experts are telling you. Take precautions. The best protector of your own health is yourself. The government can only help you, but it is you to make sure that you take very good care of yourself. I also want to urge the policy makers, please, let us listen to the experts as we formulate some of these policies on some of the problems that we are facing. Like, I can't understand how, removing askaris from Nairobi CBD is going to help in this war against coronavirus, because we are going to end up with hawkers all over, in discipline all over town, and that will not help. So we will still need a society to be orderly. And the whole idea here is being orderly, making sure that people are not over-interacting with each other. Today I heard somebody saying that's the offer they can make, is to remove city council askaris from the streets. And you know what that happens then in Nairobi if you do that. The streets get congested, everybody, there's no movement. So let's have a coordinated approach that is well informed, that is contributing towards this war against the coronavirus. But have courage that if you do the right thing, soap, water, self-quarantine, taking good care of your family, unnecessary movements, avoid them, then you'll be okay.
Okay. Well said.
True. Well, for me, the key thing would be to say that less panic and more action. Less panic, Kenyans, and more action. Pay attention to the directives from the Ministry of Health. Pay diligent and attention to the directives from the President. And then most importantly, wash your hands, keep clean. And indeed, as they always say, cleanliness is next to godliness. So let's be clean. Let's try and ensure that we are observing those sanitation practices, and that we are, like we've been shown today, we are using our cough pocket, practicing etiquette and hygiene. So let's keep clean and let's be proactive, and less of the fear, more of the action.
Okay.
Yes.
And we shall overcome.
Mm-hmm.
We have
Indeed.
done that before.
Yeah.
All right, we need to do the final part of the show, but let's take you back to Top Trending because we need to know what's happening in the country. Let's see how the coronavirus has been doing. And of course, it's still trending at number 4, Chinese virus. And of course, coronavirus outbreak is still trending tonight. And sidebar is trending because of obvious reasons. People are paying attention to what we have said. And ladies and gentlemen, people have really liked what you have to say tonight, and it's quite educative. So let's do the final part of the show. And the headlines for the last few days have been everything but encouraging. Inevitably, fear and panic followed the announcement that COVID-19 was reported in the country. What followed was, to say the least, a lot of not well thought about reactions among you, the citizens, even as the government moved or upped its interventions. Tonight we take you back years ago when Kenya woke up to similar headlines of concern. And we begin with 38 years ago. That's April 1982. The headline was Cholera Kills 15, Battle to Control Epidemic. Some 23 people put under observation while 500 had been examined and discharged. Let's move now to 27 years ago, February 1993. Yellow fever kills 63. Next is 26 years ago, cholera deaths now over 10,000, and this was July 1994. The death toll among Rwandan refugees, of course, we know what happened in 1994 in Rwanda, soared past the 10,000 mark. And that day, as agencies poured in emergency aid at an unprecedented rate. Now, December 1999, the headline, shocking death toll of teachers. Teachers in Kisumu district are dying of AIDS faster than the government can replace them. Shocked MPs were told that's in June. In June 2009, also that's the headline now, man who came up with swine flu, 20-year-old student came from the UK, university in the UK where the bug was spreading. He has been in the country, or he was in the country for a week and traveled 350 kilometers by bus. And, pardon? In Kisumu, all right. And finally, in 2009, the headline, tight border watch as more flu cases are probed. 3 new patients being tested as Britain's contacts rounded up a few of the few times that this rounded up the contacts. Now, these are a few times that reminded us that nothing is insurmountable. And this, with that headline, is a good place to end our show tonight. Thank you, lady. Thank you, gentlemen, for coming and sharing. And at least tonight, I'm more confident than ever. Kenyans who have been watching, and it's a good thing they're home, have something to smile about. And it's not all gloom. Thank you for watching, and thanks to my crew. Right, let's do this again next week. Same place, same time. Have a good night.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain.
If symptoms persist, seek medical advice.